Today, I'm going to tell you how your legs and feet can warn you about your health. I'm a medical doctor, and I train in internal medicine, which means I take care of men and women, young and old, and healthy and sick. And I'm also a scientist who studies blood vessels. And blood vessels and what they do actually lead to those signs in your legs and feet that tell you if you got a heart problem. So I'm an expert on circulation, and what I'm going to tell you today will help you pay attention to what's going on in your legs when it comes to your circulation. Now, your blood vessels bring oxygen and nutrients, and all the oxygen that you breathe and nutrients that you eat right to the cells, muscles, tendon, and bone in your legs and in your feet. When those blood vessels are working well, you're actually going to be able to walk around and run and do all the things that you normally do in life without a problem. When those blood vessels have a problem, one of the common problems is that they get blocked up with atherosclerotic plaque. They narrow down. Now think about it. It's like a drinking straw that you cut in half. What's going to happen? You're not going to get as much fluid in it, just like if you had a half the size of a drinking straw, same amount of sucking up the liquid, it's going to be a lot harder and you're going to get a lot less. Now, that's frustrating when you're actually drinking out of a small, thin straw, but it's actually terrible when it actually happens in the legs. When your legs don't get enough blood flow because your blood vessels are narrowed, then you actually have a crisis in your legs, right? Because your muscles, when they're contracting, need oxygen and they also need energy. They need glucose. They also need all the other things that are actually happening that your blood is carrying. So what happens when there's a compromise? Well, a sign that something's going on with your legs and feet is when you've got cramping. Now, we've all had cramping before, but I'm talking about the cramping where you just walk like 100 yards and all of a sudden you can't walk anymore, like you've got this terrible cramp. And it can get worse and worse where you then walk even 100 feet. Or if you were in a shopping center from, one part of the store to the next, you can't actually continue because you get terrible muscle cramping. That's actually not normal. That's a warning sign that you're having blood flow problems right in your legs. Without enough blood flow, your muscles cramp up, all right? And you got to stop. So cramping is one of those warning signs, telltale warning signs that there is something actually going on because your muscles are carrying around your frame. They do a lot of work. And then when you're actually walking around, they consume a lot of energy. And if they're not getting that energy, they're not getting that oxygen, they're going to seize up and you're going to actually have a cramp. Now, this is the condition that's called peripheral arterial disease. Peripheral because it's not central in your body, all right? It's sort of in your periphery. Your legs are considered the periphery, your legs and feet for sure. Peripheral arterial, so this means that the arteries are getting narrowed, right? And disease, obviously. PAD is what we call it, peripheral arterial disease. If you were in England, they call it PAOD, peripheral arterial occlusive disease. Occlusive means it's actually getting very, very narrow. And this is actually a problem that I know about because what you really want to do is to stimulate new blood flow in order to be able to grow around the blockage to restore blood flow. Right now, what happens if you have this type of cramping, a surgeon, a vascular surgeon, will do all the studies to define exactly where the blockages are. And they can take a catheter through your groin and stick a balloon all the way down into where the blockage is and blow the balloon up, press the plaque out or just actually rotor-rooter out the blockage and put a stent in. Okay, this is like a wire basket that pops open and pops that blood vessel open where it was narrowed. And now you've got blood flow again. So you can actually solve this problem of peripheral arterial disease with a stent or angioplasty, which is actually where you blow up the balloon to be able to open up the blood vessels. Now, listen, this is not a local problem. People with peripheral arterial disease have a systemic problem. So it's narrowing of the blood vessels everywhere. These are the people that have narrowed the blood vessels in their organs, in their brains. So they can also have basically narrowing of the brain blood vessels, and that can lead to cognitive issues, memory problems, and in fact, ultimately vascular dementia. Vascular dementia is much more common in Alzheimer's disease. It's actually something that we see as blood vessels get hardened, okay? So now you learn about one warning sign that is actually cramping in your leg. Now, a warning sign number 2 that you should be aware of is when you actually have a wound on your feet that doesn't heal. Now look, most people, if you cut your feet on something, like step on a piece of glass, step on a nail, hopefully you had your tetanus shot, but let's say you cut yourself, what's going to happen? First, you're going to react in pain, ouch, pull your feet back, and then you're going to lift your foot up, okay? And you're going to see if it's bleeding. And if it's bleeding, you're going to rinse it off. You're going to wash off all the bacteria that might be on there. Could have put a bandage on it, right? And basically, as long as you keep that clean and it's not too deep and you've removed all the foreign material that's there, which is why you want to really wash it off well, that wound will heal up. I mean, it starts to heal as soon as it forms, but by a week to 10 days, your wound will actually do pretty well. The foot, the bottom of the foot especially, is a very dirty part of our body because it's in contact with the ground or the inside of your shoe.